so that we will start off our new year, right? Welcome to everybody on Facebook, the radio, social media. We're very, very happy. And we're going to have a wonderful session because I know we're going to talk about food. And some people may like it, some people may not like the information. You know, the other day I was thinking about the typical diet that a lot of people have a typical diet, all right? And take a Sunday for Jamaicans that have Sunday dinner. And you have, oh, let me put on my video. On a Sunday dinner, and you will have rice and peas. Now, rice and peas is a complete meal. I did a feeding in Africa on the 12th, and that's what the people got. They got white rice and peas. That was their complete meal because white rice and peas is a complete meal. But look about our meal now. We have rice and peas, which is a complete meal. Then you have macaroni and cheese, which is another complete meal because the macaroni made of flour is a carbohydrate and the cheese is a protein. So we have another complete meal. Then we're going to have to that dish, we're going to have potato salad, which the potato is a carbohydrate and the egg is the protein. So you have another complete meal. So you have rice and peas, you have your macaroni and cheese, you have your potato salad. Then you're going to have your chicken or your beef, your pork, your oxtail, and your piece of fish because it's the holidays and you're going to eat, and there's no space there for the vegetables. You would love to have the vegetables, but there is no space. And if you eat like that, then don't you know you're going to be sick? So this is a very timely topic where we're going to talk about eating wisely. You don't need to have 3 complete meals on any one dish. And if you're going to have that, then Rachel is here and we're going to talk about portion. How can you have a little bit of this and a little bit of that? Amen. In Jesus' name. Okay. Rachel, very happy to have you. Welcome again to the program today. And as I introduce the topic, we're going to be talking about food. Amen. So God bless you. And now it's over to you.
Good afternoon, everyone. So always my pleasure to share on Dr. Monica Jones' program. Thanks for having me, Dr. Jones. Well, I must say, don't mind my look. I did 42 2 days, Saturdays and Sundays. I've done 24 hours. So I'm really burnt out. But I'm gonna proceed with my presentation anyhow. Before I start, I just want to say a brief prayer because I've been coming with a lot of opposition since I am preparing this presentation. So that we just invite the Holy Spirit in our midst. Let us just pray.
Heavenly Father, God, we give praise, glory, and honor to you, oh God. We pray today, oh God, that you will anoint Rachel, oh God, to teach. Give her clarity of mind and of thought, oh God. We come against every adversity, every distraction, oh God, because we know we're going to have a wonderful time in your presence, God. We ask for wisdom, knowledge, and understanding, God. Help us to apply what we know to, oh God, so that our days may be long upon the earth, oh God, that we will not eat ourselves to an early grave, oh God, but that we will have the discipline to control our appetites. And every appetite that we have, oh God, we bring it in subjection to the Holy Spirit. Be with us today, we pray, and help us to have a wonderful time in your presence. In Jesus' name, amen.
Amen.
Praise God.
Okay, so today we'll be looking at, how we eat healthy. And as we're going on to the Christmas break, this is when we normally have an influx of patients in the hospital because the sugar is out of whack because of the, cake and the cereal, and the pressure is also out of whack because of the, a lot of wine. And we know that anything with alcohols carries a lot of fat. And once there is excessive amount of fat, then that too can actually increases one's blood pressure. So before we start today, I just want to do an overview. And it says that we should aim to practice healthy eating habits in order to prevent rather than having to treat or to control diseases associated with our food habits. Healthy eating always has specific benefits for all of us. Now, this is same thing like counterproductive when we tell persons, you know, take the medication. I am, you know, one of the nurses that I usually focus on the patients that, so I always encourage them to change your dietary lifestyle, you know, incorporate your exercise, you know, what you eat, your portion size, you know, and always ensure that you get adequate rest. Those three ingredients are vital, you know, for healthy eating habits. So we not should just not aim to say, okay, we're gonna eat and eat, because in this season too, I can tell you, I have an aunt who is actually guilty for that. So she will be eating up all this stuff and then she actually takes, you know, an additional amount of insulin. Now, that is being counterproductive in itself, because furthermore, you're not actually taking the correct dose that is prescribed. And while the sugar is high, once the sugar is high, you're actually doing some damages to the organs, the other organs that is there. So that is why we really don't want to be having to treat or control. We want to prevent it from happening. So it says a well-nourished person who practices good food habits has a better work attendance record and is more productive than those with poor food habits. He or she also gets less sick less often. And that speaks for itself. You know, you don't really want to, you know, be eating poorly. As I said, you're going to end up with the diabetes. There are days that the sugar is going to be high or the sugar is going to be low if you don't control it. And so you're going to be feeling sick. And when you do feel like that, you really cannot function, because what happens is that if you're feeling weak, it means that the glucose is not going into the cells. And if it's not going into the cells, so is the brain cells. So the brain cannot function. You cannot think. And that is why when the patients are in a comatose state, they are actually not able to do anything, because the brain has actually been shut down because there is not enough glucose into the cells within the brain. All right, so before we even speak about portion size, I want to bring us to our 6 food groups. And as Dr. Monica was speaking about, the multi-mix principle was what she was mentioning. And if we're aware of our multi-mix principles, then we would know that we don't overeat certain amount of food. So when we have our meals with our rice and peas and chicken and vegetables, you know, that's actually probably like you're actually consuming one particular meal twice. Because as she mentioned, the rice is carbohydrate, the pea is protein, the chicken is protein, right? And the vegetables, some vegetables does carry starch as well. So for instance, like your corn or the green peas, some of those do have carbohydrate. So you see what you're doing now, you're actually over consuming starch, and the end product of starch is glucose. And we do know that excessive amount of glucose in the body, what happens is that naturally for normal persons without diabetes, the bodies actually store these glucose into the liver cells, and they store them as glycogen, right? So when we actually need them and we get weak, our body always find a way to compensate. So it actually pull on these stores within the cells, and so we regain our energy. But sometimes during that time, based on the fact that we would have actually been weakened for some time, we would definitely need no supplemental fluids, or we may need to take some intake of something sweet to actually increase that level. Now, with somebody who has diabetes, what happens is that your pancreas is supposed to be producing the insulin. So with diabetics, for the type 1, their body don't produce insulin any at all. For the type 2, the body might not be producing enough, right? So that is why for the type 1 diabetes, the only treatment for that one is that they have to be insulin dependent. So they have to constantly take insulin. For the type 2, because they would have actually had inadequate amounts, so there is still some work that the body can do based on the stores that it actually has. So the body actually works as a lock and key system, right? So when we eat, we have receptor sites that actually now bind to the receptor sites binds to the insulin, right? And the insulin, once it actually binds, it's like a lock and key. So once it binds, it actually fits with that particular receptor site, and then it's able to carry the glucose into the cells, because it is actually in the cells that the glucose is needed to give you the energy. Now, with the diabetics now, sometimes they do have impaired receptor sites sometimes. If you notice, most of our diabetics, a lot of them have a lot of abdominal fats around the waistline there. Studies now have shown that that is one of the risk factors when you have increased abdominal girth, that is actually going to decrease your ability to actually for the insulin to bind to the receptor site. So that is one of the issues that we have. So in addition to that, what you have is that now all of this glucose, all the meals that you had now, you just had the meal, all of this excess glucose is now floating around in the body, right? It cannot get into the cells where it is needed. And so you will be saying, oh, but I just had something to eat, but you're still feeling weak because your pancreas is not producing enough insulin. So there is not enough glucose getting into the cells where it is needed, just like a normal person. So you're still going to feel weak. So of course, when we do the urine, there we're going to see excess urine, excess glucose into the urine, or when we prick the finger, then we see the sugar, maybe HI or whatever the reading, it's going to tell us that it is high because there is excess amount of glucose floating around. Now it depends on what, how high the sugar is now. Then just like how it's actually not getting within now, the cells, it is not getting in the brain cells either. So, become confused, right? And a state of confusion. So the person starts sweating profusely, they start trembling, all of that, because you're now weak and there is not enough energy. The body is lacking energy. So that is what happens with the diabetics. And so for persons with the type 2, we will give them diabetic drugs like metformin, and we have a whole lot of them. But as I said, we should always aim to ensure that we have a balanced diet so that we don't get too dependent on the medication. Because while doctor will say that you need to take your medication, I'm also saying that it is very important that we try to abide by the 3 principles, which is getting adequate rest, right? We eat the right type of food in the correct multi-make principles, so we don't overeat one type of food, right? And then too little of the other. So it's supposed to be a balanced meal across the board, right? And then we do increase our exercise, because when we exercise, what we do is burn the calories, right? And excessive amount of calories actually is stored in the body as fat. So that is why you don't want to eat too many fatty foods. Because when you go to the supermarket, right, when I'm through with the principles today, hopefully you will be able to see the portion size that I'm going to mainly deal with tomorrow, that you will actually see how much of the portion is needed. Now, that is basically only a guide, because how we do the assessment based on dietary intake, it's based on a lot of things. So it's based on the age, it's based on the sex, because we know that with men, they tend to have more muscle mass, right? And so they will require more calories. Somebody who is obese, you will require less calories because you have a lot of fat on board, which is actually excessive amount of calories stored is going to actually be stored as fat. So now if you are somebody who is obese, you don't want to really consume the same amount of calories as somebody who is basically undernourished, or somebody who is very slim would actually require more calories than somebody who is fat. But in Jamaica, we do it the other way around. So because we're so gluttonous as a person, and if you notice when you go to some of these areas, some of the persons who are obese, they continue to feed on these fast food, right? Which, as we mentioned, just look at a burger. Look how many mixes. And we say sometimes it's a balanced meal, but it depends on whatever else is in the burger, right? So the bread is basically a source of the carbohydrates, and the beef would have been the protein. But then you have various mixes of other vegetables, right? So sometimes you'll be ending up getting extra carbohydrates there, depending on whatever you consume with that burger. And then the fries, again, is an additional carbohydrate. So we see how we're actually heating ourselves to death. And so constantly feeding on that, then we're going to end up getting these chronic diseases, whether diabetes, hypertension, even the same lupus, because remember, lupus is a condition that is caused from your good cells start attacking itself. And that is because sometimes poor eating habits. So your body, the cells are not able to function over time. And that usually happens. Right?
Okay, 1 minute, Rachel, 1 minute, just to stick something. When you were saying that, and something they can do during the holidays, instead of just eating and sitting down talking, to get up and walk. After you eat, just walk, just don't sit down and don't do nothing, and the food is there, and you do not burn up the calories because you're sitting and talking and eating, and go back for the second plate and the third plate, and you're not walking around and burning up the calories.
And even the last time when I presented on the poor circulation, remember I said that for persons who have these jobs that they do excessive amount of standing, you know, from time to time, you should get up and actually, you know, walk your foot around the office or stuff. And the prolonged sitting is a problem and the prolonged standing is a problem because of course the blood is not circulating as it should. And we do mention too that you do not want to eat at after a certain time, right? If you're going to eat the food after a certain time and you know you're not going to exercise, then you shouldn't. If you know you're going to eat and you're going to exercise after, then fine. But what happens is that when you actually eat this large gulp of food, you know, what does that mean is now that the brain is now, if you're actually a normal person, the brain now gets this excessive amount of glucose, right? So some is going to be stored as fat, and then the others that is there floating around now just cause you to have narcolepsy. So you feel like you want to sleep. And so if you do have the drive to really get up and said you're going to exercise, you will fall asleep by the time you even get to exercise. So that is why it is not good to eat, to overeat. You know, we always ensure that you actually do some form of exercises, right? And as we said, get adequate rest and you eat the right portions, because it doesn't make sense. You're going to eat this big plate of food, right? Then you're going to store this excessive calories, which is going to be stored as fat. And we know what fat does, right? It's going to block the arteries and later you're going to end up with high blood pressure. And usually high blood pressure and diabetes, they go hand in hand. So most persons, once they end up with the high blood pressure, they're going to end up with the diabetes and vice versa. They end up with the diabetes, they're going to end up with the high blood pressure. They're all cardiovascular diseases. So once you actually have any imbalance at all in one system, right, it's going to affect the other one. So here we talk
and
about
wait 1 minute, Rachel, and then they call this niggeritis because you eat your belly full, you go to sleep.
Right. Some persons say niggeritis, some persons, well, the medical term, we call it narcolepsy, but it's actually niggeritis in layman terms, as we said it. So because of the excess amount that you're eating is now, like, as we said, it's not getting into the cells as fast as you should. So you now starting feeling drowsy because you eat too much and all of that calories is not, it's not burning, right? And then over time, you continue doing that. What you notice that is that, oh, you say, oh, you know, my belly getting big, because all of that, the belly is where stores fat mainly, right? That is where you find a lot of adipose tissue and under the skin. So once you basically, you know, go to bed with all the food is not going to get to go through the proper phases of digestion because you're not actually up and getting all those calories burned. So it's gonna just be stored around the waistline there. And as we mentioned that over time, when you have increased abdominal girth, then it puts you at risk for diabetes because it's going to reduce the receptor site. So the insulin won't have enough site to bind. So you might have 6 or 7 insulin and you just only have 2 receptor sites. So if you have that situation, you're just going to have 2 insulin binding to 2 receptor sites. So you have all of that other insulin storing about, cannot do any work. And so we don't have enough binding lock and key system to bring enough glucose into the cell. So you're still slowing down your metabolism in any way you check it out.
And Rachel, that just brings to point what you were saying about the time in which you eat. Because if you're going to have like a Christmas dinner or you go to one house and you eat at say 2 o'clock, 3 o'clock, and then you go to another house and you have another one, and then you go to another house. Then by the time you finish eat at one place, then people go from house to house during the holidays. And then that's a disaster. Exactly. I mean, if they were taking the food and say, okay, let me take this and bring it home. My stomach is full. Let me eat some salad. At your house, I'm going to have the salad because I already have the meal there, but I left space for you to get the salad, take the rest of the food home. And by the last one, I cannot have anything. Take it home with you then to go, oh, I went to this house and that house and that house, and I eat and eat. You're not doing yourself any favor. Right.
Even going to the fast food restaurant. So when you constantly go and you have this big meal and then you said, oh, afterwards you're having the dessert and the cake and the ice cream. It's not good. You are actually consuming far more multi-mix principles than you really need, right? And the thing about it is that, as we mentioned, that all the systems actually works in collaboration, because remember now, your food takes within 4 to 6 hours to digest. So when you leave from John Tom's house at 3 o'clock, and then by 7 o'clock, you go to another friend house and you eat, the food is not even finished with the one stage of digestion is not even completed, and now you start eating again, right? So the good thing about the body is that it always usually find a way to compensate, as I say, and try to help us. And that is how some of these excessive calories now is going to store as fat. But you don't want it to be stored as fat either, because as I mentioned, with that excessive amount of fat that is stored, it's just going to stay there and start blocking the arteries. Some person end up getting intestinal obstruction, so the intestine is blocked, right? Because you don't have a good GI motility. So it means that you doesn't probably go to the bathroom very often to pass your feces. And then over time, what starts to happen? All of these feces start building up, right? You start getting bowel obstruction, which is basically a surgical emergency in the world. It is a surgical emergency because
okay, Rachel, I was gonna talk about that, but seeing that you go there, let's talk about it right now, because
the bowel obstruction is
because that is so important. If you're gonna be eating, you have to be pooping or defecating or avoiding. You have to do that, because just like the baby eat, poop, sleep, eat, poop, sleep. And as adults, we should be doing eating and pooping. You eat, you poop,
the same thing.
In the same way.
And so that's why God has made all of these systems. The elimination process is important. Everything is a balance. So if you're eating all of this food and you're not, we have patients to the point where no matter what meds we give them, it doesn't work. So we have to go in sometimes and use and manually take away them out from them so they can feel comfortable, because it is very uncomfortable. And over time, with all of this excess pressure on the bowel, then any form of abnormality to the cells over time, you end up with all of these bowel cancers. And that is why there was a study that shows that person who mainly works at night, they were more at risk for colon cancer. Why? They're up at night, they're working, they're studying, and they're snacking right throughout the night. Their system doesn't get a chance to rest. The digestive system doesn't rest. And so you're putting that system under subdued stress. So over time, when these cells become dysfunctional, that's what you start having, abnormal cell growth. So you start having cancers.
Right. And not only that, when John Wayne died, it is said that when John Wayne died, he had like 30 or 40 pounds of feces in him, and it burst his colon. Because when you eat, and you're not voiding, because if you eat 5-6 times a day, and some people poop once per week, and they think it's not good to go once per week. It's not good to go once per day when you consider how much food you have intake. And if you have ever seen, and I don't know if they noticed, but sometimes even when you give them the enema, not even the enema can go
even the enema. I'm telling you, sometimes we call it manual evacuation. Sometimes we, the nurses, have to go in and we have
take
to
it out
manually
because
take it out manually. But even that is even painful for them. Because as I said, remember, the bowel is actually, even though it is made of elastic fibers, it is only made to stretch beyond a certain point. Right. So when you have all of these feces backing up, and so you become obstructing. And as we mentioned, then that's a form of emergency, because that obstructive area now start causing other problems within the peritoneal cavity, right? Where you have other organs. And so you end up with peritonitis, which is inflammation of the peritoneal cavity. And that too is another emergency that usually kills a lot of persons. So when we're eating and we think that, okay, some of us, we have been eating the food and we're not having, bowel action as we should, probably eat up to 2 weeks. And some of us are not even concerned one bit, but you should be concerned, because the body is actually built to do that. You're supposed to eat. That's a point when you digest the food. Once you digest the food, you're going to have waste. And that is where the kidney comes in, right? So once you actually eat this food, if you drink a meal that is actually has any alcohol base, what the liver does, it detoxifies the system, right? So it gets rid of all the toxic things, send it to the kidney. The kidneys now do its other processes, and then it get rid of the waste through the process of elimination. So some persons, you urinate, right? And you get rid of some of the impurities there by the urea, but you still have some that is actually from the feces. So if you're actually not going through the regular processes of elimination, then you're going to be in problems later. And as we said, we see all of these problems coming in. You have Crohn's disease, you have diverticulitis. All of these gastrointestinal problems are really sometimes because of our poor eating habits.
Okay, so someone is asking, just a minute. Someone is asking, how many times per day should you poop? I'll let you go first. Go ahead.
Well, it really should be 3 times. If you really go 1 time, that's okay, right? But you should really be going out each day. You really should be going, because as I said,
Once
the
is
only way
very
you don't
poor
go
though.
out
Once
each
is
day.
poor, but it's better than once per week. Because I know people
Right,
who go
right,
once per week and every couple of weeks they're in the
right.
hospital. And
And
I'm
I
like,
was
that
just going
is
to
never
say,
good. Never
right.
good.
If you go out 1 time for the day, it depends, because what if you were on fasting? There wouldn't be anything really.
In your
And you
stomach.
see, the digestion is very, very important, because this is another thing in itself, that a lot of us fast and we don't even know that you should really take some time to gradually start to take back things into the body. So you can't finish a fasting and you eat a big gulp of rice and peas. No, it's supposed to be gradual, because remember now, the stomach would have actually been starving, right? So when you actually go and you eat this big gulp of food, right, you're actually shifting the equilibrium of the metabolism that your normal GI system the digestive system would have gone through. And so sometimes because of that, now you end up getting diarrhea, because it's like the body is now it's basically confused. It's not able to readjust to the normal digestive mechanism, right? So if you're actually on fasting, you should really you break with probably like some room temperature water, or you drink some tea, and you can probably have a sandwich, and then you gradually later, then your next meal, you can probably eat the rice. But you can't just break with a big plate of rice. And because what happened when you're not eating, right, when you haven't eaten for a period of time, that intestine, the area within the intestine there, it's actually filled with wind, right? So over time now, when you start eating these big gulp of food now, it's now that the food is now actually replacing the wind, right? So it's actually now filling up that area that the wind would have been. With all of that process now, it's causing the intestines now to do more work. So you may end up with diarrhea because of that. So it is very important that you take all of these things
Okay, let me
into
say something.
consideration.
Yeah, let me say something here, Rachel. And somebody was asking a question here: is intermittent fasting good? Yes, it's good. Why?
Yes, it's good.
Because number one, not only spiritually, but for your body, the Bible says your health will spring up. Because if you eat 6 times a day and you only poop once, it means there is a lot of poop inside you. So when you're not fasting, your body is now catching up with eliminating and getting it out of your body. Because when you are compacted, I don't know if you have ever seen real compacted, the poop will get so hard. It's like
very hard.
You could take a hammer and beat that thing, and
very
it's hard. Even to it's like a rock. It's like rock.
Because
and then bacteria begin to grow in it, and then it's ashy gray or white, and then you have all these things that the bacteria get in it. I remember one time I assisted a nurse to help a patient who was impacted. And when we were taking out the poop, it could not even flush in the toilet. I had to take the poop and put it into a plastic bag, and then put that into another plastic bag and put it in the garbage. I was there flushing and flushing. That thing was so hard, not even the toilet could take it out. And it's very, very dangerous, because all those toxic gas go back up into the body, and it's going into your tissues and your organs, and you can get all kind of cancer and this bad feeling and sensation in your stomach. So intermittent fasting is good, but like she said, vegetables are always good to break your fast with, because they're like 95% water, and it's easy to digest. Lettuce, those things are easy to digest. Then you work your way gradually. If you're fasting for any period of time, you break yourself gradually into food. Because I remember when I did, like I went days without eating, and if you overeat could be eating 4 crackers instead of 3, and then you feel that weight in your stomach, because when you do not eat, your stomach contracts. So when you start eating again, it begins to expand. So you can't expand it too fast. It has to be expanded gradually. So when you're fasting, you really have to sit down and count what you're going to eat. And the next thing, your intestine is like a coil, right? It's supposed to be like a coil. So when you poop, your poop should have the shape of the coil. If you do not have enough fiber or water into your poop, it's gonna come out looking like a banana, solid and intact. It's not supposed to be solid and intact, because when you pass it, it must break. But when it breaks, it comes in the shape of the S. So you can still see, if this part was connected to this, you could see the shape of a coil, because your intestine is like a radiator coil. It's not something straight. So it's not supposed to come out straight and tough. And you can watch it, because the source of your health is what you're putting out. Your waste is just as important as what you're eating. Because if it is too yellow, when your body take out what it needs, everything else going to waste. So if your poop is too small or too big, you have a problem. If it's yellow, you could be anemic. Because why is it yellow? It's supposed to be like dark brown. If it's dark brown, it could be blood in it. So you have to watch what you're putting out. Okay, go ahead now. Right now, you're going to pick it up from there.
Right, and as Dr. Monica is on that topic as well. Remember that we have the stomach actually produces digestive enzymes. So after you would have actually digest these food to a point, right? When you eat this excessive gulp of food and all of that feces is actually there and impacted, the digestive enzyme would have stopped working over a period of time. So the stool becomes so hardened, right? So it's very difficult for you to pass it out. And that in itself, sometimes some persons can end up that's how a lot of persons get hemorrhoids, because now they have to be forcing to defecate. And so the hemorrhoids in itself is another problem, you know? So we should really look at how we eat and also the portion size. Now, we mentioned that a balanced diet cannot be overemphasized. And that is why even when you actually look at the multi-mix principle, you still want to know what is a balanced diet so you can know how to mix your food, right? So we say here, we have our staple foods, which is actually consist of the same carbohydrates, and the staple, the large group for that is actually carbohydrates. So your flour, your bread, your wheat, your barley, your fries, all of those are carbohydrate foods. Then you have your vegetables, and the carbohydrate group is the largest group. And the carbohydrate food is actually the energy food. Those are the energy giving foods, right? So that is why when you drink a soda, and that is why you have to look at the calorie contents, because the more sugar in the diet, anything that has to do with carbohydrates, remember that the end product of starch is sugar, right? So anything with too much carbohydrates, the end product of that is that you're going to be ending up with too many calories, right? And as we mentioned, that those calories now is just going to use what the body needs. And if you're not actually living a physical lifestyle, if you're living a sedentary lifestyle, then that excessive calorie will be stored as fat, right? So we have our vegetables, and you know the vegetables, we do have vegetables that are actually rich in carbohydrates, as we mentioned, which is like our green peas or sweet corn or corn, stuff like that. We have our milk and other alternatives. And this group, for persons who are actually sinusitis, or some persons are allergic to dairy products, then you should be very conscientious with it. I notice a lot of persons will say, oh, you know, I'm gonna eat some cheese and then I'll go home and I'll take some Puritan, or I'll take some DPH, or you know, some anti-allergetic drugs and stuff. But that over time in itself can be problematic, because the sinuses, right? So we have different sinuses. We have our ethmoid or sphenoid sinuses. We have our facial bow sinuses up here. Those are actually holes, right? That connects the ears, the nose, and the throat. So when those sinuses are blocked, sometimes you tend to get like a tension headache. So you feel like you might be having like facial pain, right? Because the sinuses are blocked, right? And basically you're supposed to be having like fluid, normal fluid draining and stuff. That's fine. That's your sinus, right? Some persons will feel like it's actually draining at the back of their throat. So when you eat these foods and you know that you're sinusitis, what you're actually doing now, you're causing the sinus to become inflamed, right? And then over time, those sinus can become infected. Now, persons with sinusitis actually can now end up with the ears being blocked, right? Because as I mentioned to you, that they're all interconnected. So you may feel like you have a head cold, or you probably have the fan on, and then you feel like your ears is blocked because you might get an ear infection. And remember now, the eustachian tube in the ear is responsible for your balance. So if your earring is blocked, then you're probably going to feel like you're actually going to be, you feel like you're having vertigo, like the place spinning, or you feel like you have no balance. So all the systems are you're supposed to take into consideration the underlying conditions that you have. And if you're supposed to eat these food, then you have to eat them in moderation, right? Because you don't want to cause another problem to happen. And as we said, you affect the sinuses become infected, then it starts draining on the stomach, then you end up with, a cold, or you end up with pneumonia. So one thing can lead to the next. So we have to try and see how we can start eating healthy. It's very important. Now, our fats and oils, that is one of the other area that is actually rich, again, in mass, right? In calories. So you don't want too much of this, because if you notice, fat is not something that really digests very well, right? And so excessive amount of that is going to actually blocks the arteries. So we do need fat, because if we don't eat fat, right? A lot of us, if you notice your body, your integumentary system, where you have the skin, there's a lot of fatty tissues under it. Now that is important, because the skin and the blood flow is actually what helps to warm us. And that is why persons who are anemic, they tend to feel very cold, because they don't have enough blood circulation going on, because the oxygen carrying capacity, which is the hemoglobin binding to the oxygen, is reduced because they have less red blood cells, right? So is with the skin. So the more adipose tissue you have on, which is more fatty tissue, you will tend to feel warmer than somebody without less body fat. So each of them has their place, but as I mentioned, it's just a balance, and you do so in moderation. Then you have your protein-rich food, right? Very important. And as we know, that protein is good for, it actually helps to heal the wounds. It helps for ear growth, tissue repair, and stuff. So when you eat a food and you feel burnout and all of that, while the rest is good, the protein is actually what is going to help to repair those cells. And if your cells are not repairing, then you're going to still feel weak and lousy. And that is why persons with protein energy malnutrition, what happens is that they don't have enough protein, right? And so because of the whole malnourished, so they start having muscle wasting. If you notice, they're having muscle wasting. So they start feeling weak, right? And as we mentioned, the reduction in the body mass, the fats from the skin is actually being reduced. So those persons tend to basically feel very weak as well. All right. So our proteins, and we know we can get our proteins from our meat source, our fish, our chicken, we know we have the vegetarians who really don't eat meat. We have different classes of vegetarian. So we have the uber vegetarian, that some of them just eat eggs. We have the pesco, they only eat fish, and so on. But the thing with what I normally educate my patients about, we do have persons, especially for the Adventists, they do eat very healthy, but it's a little drawback with their eating habits as well. Because when they're eating the beans, right, they would now have to stock up on the portions of the beans, right? Because of the fact that they would have actually eliminated the meat, which would have been so rich in protein. But the thing with the vegetarians, sometimes they tend to lack vitamin B12, right? Which is called cyanocobalamin. And so with that, sometimes they tend to start having some muscle rigidity, and they start having muscle weakness. There is one condition, I don't remember the name right now, but as soon as I remember, I tell you that is very prominent for some of these vegetarians, right? So everything is a balance. So while you will say, oh, you're not eating meat and you're stocking up on the beans, you do have to ensure that the beans is in the right amount of portion, so you don't end up with these deficiencies, these dietary deficiencies. Also, if we notice persons who the calcium rich foods, right, is very important as well, your calcium. We saw a mother, she actually was pregnant and she wasn't consuming any calcium. Now, with the babies, when you're actually having a child, it's a parasitic kind of relationship going on. So that child is going to pull everything from your bloodline, right? From your within your circulating cells to survive, everything that they need to survive. So what the baby was doing was actually taking the mother reserve calcium, right? But she doesn't drink milk and she doesn't eat cheese. She doesn't eat most dairy products. And when that child was born, the mother, all her teeth became dark because she had no oxygen, she had no calcium reserve. The baby pulled everything that it needed to survive. And persons who don't have enough calcium sometimes within their diet, their baby may tend to born with scoliosis, that is the abnormal curvature of the spine. You tend to born with like rickets. So that nice fancy thing that we think is sexy, which is bandy legs, it's actually rickets, right? It's a vitamin D deficiency. So all of those, most of those conditions that you see, it's because they're lacking in some form of nutrients. The fruits is also important. And with all of these things, you eat in moderation based on your pre-morbid condition. So if you're no diabetic, you know that I normally encourage my diabetic persons to try and have probably like a half portion size of banana, because the banana is very sweet if you know that the sugar is not controlled, right? Because as I said, you don't want to be sending up the sugar and then you have to go and say take extra insulin, because the thing about it is, once some of those conditions are out of line, it usually takes some time to get it back under control. And while it is being uncontrolled, it is actually damaging whether the eye cells or the heart, or it's actually damaging some other systems, right? So we should really try to strike a balance. Now, before I actually go into further, I want us to basically, what is the definition of nutrition? So it is the study of food, which is why we have the food pyramid there. That's how we know what we get from that food, whether protein, carbohydrates, what type of food give us what. That is all we basically know. And how each of those nutrients that we get from the food, how it affects the growth and the health of the body. And as we mentioned, remember that we mentioned that the protein actually helps with growth and repair of the tissues and so on. All right, so each of them have their place. We have our vitamin A, which actually helps with our eyesight, which is actually good, and it's called retinol, which is very good for our eyesight. So when we do eat, we can't just eat just the food within the 6 food group, and we don't take in consideration the fruits, because the fruits is what has the minerals, right? And the minerals, you don't want them in large quantities, and later on we will see why. So as it says, that is a process by which living things receive, utilizes, or you use it. So if you're eating all of these foods and you're not exercising to burn the calories, then you're not utilizing what you have had, right? And you also should ensure that you know how to eat. So if you're actually eating something that is actually rich in vitamin C, you cannot drink it with milk, because now vitamin C is going to actually inhibit the absorption. And remember that vitamin C is very, very important, because that is what actually boosts our immune system. Our vitamin C, our zinc, and our B vitamins, very important for boosting our immune system, because we have persons out there with very healthy immune system, and they will actually be exposed to a particular condition. They do colonize that condition, meaning that they come into contact with somebody infectious, they have the disease on board, but they're not actually showing any signs, right? So you can almost call it that they're healthy carriers, right? So all of these are important in basically how we eat, right? When you eat poorly, then you're actually your immune system is now going to be compromised. And so you tend to get every little thing coming around. So you'll get the flu, you get COVID 3 and 4 and 5 times. That is because your body doesn't have that reserve to really deal with it. All right, so the nutrients now, as we mentioned about the nutrients. The nutrients is basically what you get from the food. Your minerals, your vitamins and your minerals, those would actually be inorganic, right? And you have your carbohydrates and stuff, and your proteins, those are organics, because you get those from meats and compound. And we do have inorganic that we get from our plant-based as well, right? So our vegetables, our green leafy vegetables and stuff, that has its place. That is also important. And we know that that is basically defined as the food containing all the nutrients in the sufficient amount and in the proper ratio. And that is why when we have some of these conditions, persons that come sometimes with the diabetes and certain other condition, we have to do a consult with the dietitian. And so sometimes we write a referral for them to see the dietitian because that's their specialty now. They would know what portion to give them based on the weight, because they have to look at the weight. They look at the sex, they look at whatever condition that they're having. So they have to use all of that information from the patient to know, compromise a nice meal plan to see what you need to eat and the portion size. All right, so the importance of nutrition, as we mentioned, it keeps us healthy and free of diseases, right? Psychological behavioral issues. Now, a lot of persons don't think that poor eating habits can actually cause us psychological issues. But remember, if you're not eating properly, then the brain will not be able to get the amount of nutrients that it's needed, which is actually the two vital nutrients for the brain. It's oxygen and glucose. So if you actually are lacking in those nutrients for the brain, then the brain cannot function, and so you tend to get confused, or you may get forgetful, or you might start feeling dizzy, and so on. So it is very, very, very important that we actually focus on our nutrition. It says it deals with the relationship between our diets and our body function. And remember that we mentioned the diet is as we would say, the multi-mix principle. That would be our diet, meaning that the food comprised of the various food groups and in the right quantity, right? And it says if we want our body to maintain good health, then we must supply the essential nutrients. Nothing heals the body than the body itself. It is for this reason that we need to properly nourish ourselves, right? And as I tell you, that the body always find a way to compensate. The body has this compensatory mechanism about it. So it always tries to fix the situation before it gets out of control. So we know that when we start having the diabetes and all of these symptoms coming on board, the body would have actually been warning us a long time ago. But a lot of us actually, we didn't pay attention to it. Whether it probably would have been 1 or 2 episodes of high blood pressure or 1 or 2 episodes of the diabetes. And that's why sometimes when we go to the doctor said, okay, you're in the pre-diabetes phase. What it means is that you're at risk. Your risk is greater for getting diabetes. So what you need to do to prevent that, right? You should now actually change your lifestyle, right? So how do I eat? What do I eat? The amount, the correct portions. Do I include exercise in my diet? Am I getting adequate sleep? Because remember too, when you sleep, the brain, that is how actually the brain repairs itself. The tissues, the brain tissues, that is how it repairs itself, right? And that is why there is no cure for fatigue than sleep. Otherwise, you don't know when the brain is gonna go off, and you will just find yourself sleeping and you don't even know. You'll find yourself sleeping around your car and you don't even know. So we have to ensure that we get adequate rest. And that is sometimes how the body is talking to us. We feel tired and we still go in the car to drive. But that is dangerous because, as we said, the only cure for sleep is sleep. So when the brain wants to sleep, you can only fight it for some amount of time. But then sometimes it's actually no further. And then what you're going to do, you're just going to find yourself sleeping at the wrong time, which can be very dangerous for you.
Right. No good for the brain.
Exactly. And that's how even a lot of condition, even when we have a condition called Parkinson's, a lot of these conditions, even a lot of persons don't know, when we laugh, right? Naturally, our body produces an serotonin, right? And that is actually a good it's a neurotransmitter, which is good for us, right? Because that is what actually helps with our mood and how we feel and how we relate to other people, right? When you're not laughing as much and you're not actually producing a lot of this serotonin, what you start doing now, you start having an imbalance. So you start to become depressed, right? And so remember, depressed persons, they rarely ever laugh because they're always looking sad. And so when they have that now, it's their inability now to cope that is going to push them over. So they start having other issues now, the suicidal ideation, because of now other things that is happening in the brain. So whether they're now hallucinating, and we do have different form of hallucination. Some persons will tell you that they feel something crawling on the skin, which we call it tactile. Some of them will tell you that they hear voices. right, which is auditory. Some of them will tell you that they've seen persons, it is visual. So we have different types of hallucination, right? And all of these too can actually be tied to your nutrition and your general well-being of life. All right, so we really should try to laugh more so we can produce enough serotonin to give us that balance that we need to be happy and for our neurological system to function. All right, so we mentioned additional things: give one vitality and energy for life, help one to stay at the right weight that is actually good for them, boost the immune system, improve sports performance. Now we know that if we're actually malnourished, we don't have enough energy, we're not going to feel like we want to run. And when you know malnourished people, they always feel listless and they're always tired. And so those persons don't really learn very well. So it is actually a part of self-performance. So when you actually can do the exercise and you burn all of this excessive calorie, you know, starting, if you notice when you exercise, you feel so different and refreshed when exercise has become a part of your day-to-day life. It's a different feeling that you get. And it says delay the effects of aging. And if you notice, look at persons who eat right, exercise, and actually get enough rest. Look, if you don't see those persons look more youthful. I'm telling you, look at me now, I'm looking so tired and drained because I've lacked like 48 hours of sleep. This is not me. You see what I'm saying? So it really does have effect on us, you know? So we have to go get some sleep later so my cells can repair and I can feel rejuvenated for work tomorrow. All right, so what is a balanced diet? And I'm sure I've said that already in every nutshell. It says that it's a diet that contains different kind of food in certain quantities and proportion so that the requirement for calories, proteins, mineral, vitamins, alternative nutrients is adequate, and a small provision is reserved for additional nutrients to ensure the short length. And that is what we mean, the short length of leanness. That is what we mean now by endure the short length or reserve. That we mentioned, okay, we do have some form of nutrient that we do have on reserve. So when our body is lacking or when we're on fasting, that's why when persons come to the hospital, we're not worried about the fact, and sometimes the patient come and they're so concerned, but nurse him not eat for days. We're not worried about that because persons can go for days without eating. Once you're actually being hydrated, so they're actually getting that one fluid that you see we put up, we have our dextrose, right, which that is sugar and water. So we ensure that that is glucose. They're getting glucose from the fluid. They're getting sodium, right, which is the saline that has sodium and other nutrients, potassium that is needed. So we're not really concerned after a few days of starving, right? What is actually necessary is when you probably go for a prolonged period of time with not even water and stuff, and you're not actually, you don't have much reserve. And that is why it is so important that if you're having a balanced meal, you would have some reserve. So if you're having too little food each day, then you're not having any reserve. And we do have persons like that, you know, you have the persons who are anorexic, that they don't believe in eating because mentally they want to look good and they want to maintain their physique. But naturally, they're actually killing themselves because they wouldn't have any reserve on board, right? So when they do get sick, those persons tend to actually go over. And sometimes when we do have patients who are sick, so for instance, they come in ICU, we would have actually put them actually NPO without food. So it means nothing per oral. They said they don't eat anything for probably up to 48 hours. Sometimes it depends on whatever is happening, but we do give them their fluid. Sometimes once we start giving them the food, whether it's by actually NG feeds or we start allowing them to eat gradually, we notice that they will actually improve better and they actually start recovering faster because the cells is now getting the food that they need to actually, you know, repair itself, and so they can actually feel rejuvenated and refreshed, and for rehabilitation. All right, so I'm going now into my categories of nutrients, and this is where I want to get into to actually bring us into our multimix principles, which, as I mentioned before, actually would actually go into tomorrow. So we have our macronutrients, and the macronutrients are actually consist of carbohydrates, fats and lipids, proteins, right? And we said that these are required in large amounts, right? These are actually our energy foods. Then we have our micronutrients, which are vitamins, minerals, and these are required in small portions. Then we have our special nutrients, right? And we know that special because water is very vital. Approximately about 70% of all our cells are made up of water, 70% of our body cells, right? So that is why water is so important. And it says it involved in most chemical reaction within the body, is a major component of blood and serves many other functions. And that is why water is so vital. So when persons tell you that they don't like water, right? They're actually impairing whatever the natural bodily process that is actually it needs the water to do. And as we mentioned, that is a part of the chemical reaction, right? Because when we know that it has to do with chemistry, with the hydrogen and the oxygen and binding and all of that. So we definitely need water. Now, the categories of nutrients, and we mentioned that glucose is the main source of fluid, and we did mention that glucose, we get that from carbohydrates. So that is the main source. Remember that we said that was the most important group that we get, the largest group that we get carbohydrates from, energy from. And it says here, and the end products of carbohydrates, which we mentioned, is starch, glucose, whatever. Glucose and starch is the same thing. All right. When we get like from plant-based, they would actually call it cellulose, which is still some form of sugar, right? So all of those are needed for the cells. And it says that it's the main source to fuel our cells. So when the body doesn't need to use the glucose for its energy, it is stored in the liver and the muscles. All right. So when we do need it, then it actually pulls on that reserve. So that is why we can actually have persons who don't eat for a few days and we're not worried about it. It says now this stored form of glucose is made up of many connected glucose. So you have branches of glucose that are interconnected together, now becomes molecules, and that is called glycogen. And glycogen, as we mentioned, is actually stored in the liver. So when we really need the reserve, that is where it pulls it from, right? So the body actually knows where to pull whatever from when we need it. Vitamins and minerals now. So we said that these are essential for bodily functions, such as helping to fight infection. And we mentioned about vitamin C and our zinc supplements and or folic acid, which is a part of the vitamin B group. And that vitamin is very important too. If you notice, when a mother is expecting, we would actually give them the folic acid. That's to helps to form the blood-brain barrier, helps to the formation of the spinal bones and so on. So it is very important. And other condition that you actually would want to prevent. You wouldn't want them to get some of these condition that they were born with, and that can actually lead to disability. So we actually tend to give them that along with some of the maternal medication tablets, which is actually packed with vitamins and minerals. For some persons who are actually lacking certain minerals, you notice they will tend to tell you that they have joint pains and, you know, certain type of muscle rigidity. So that is how important vitamins and minerals are. And we did mention to fight infection. We mentioned about the wound healing as well, because as we mentioned about vitamin C. So if you don't have a good immune system, it doesn't matter how you pack that diet with protein, it's not going to be able to actually absorb the right way and actually build the cell capacity, because your immune system is now compromised. So it's not able to carry out the work in the effective manner as it should. All right, it makes our bones strong. And the nutrients that is actually good for that is your vitamin D that you get from the sun and your calcium, right? And those goes hand in. And I know the sun is very hot right now, but the sun really do give us some source of vitamin D, right? And if you notice, there was a study that showed that our patients in ICU, they were getting ICU psychosis, right? Even some of the nurses. So what we do in our institution, after a certain time, we move those nurses out. So even though they are trained, we still have to break them from the department, right? Because what happens in ICU, sometimes you don't really know night from day. The patients, they don't know night from day. You know, it's actually an enclosed area. Most of the time they have the lights on, right? So they don't really know. And then the constant beeps of the machine, sometimes it really do affect them psychologically, right? And sometimes if you notice those patients, sometimes when they come out, they said, oh, you look so brown. it's not actually good. They're actually lacking vitamin C, so they look so pale and white. So while we may think it's looking good in terms of attractiveness, it's not necessarily so. So the vitamin D is important. And as I mentioned before, and this is why vitamins and minerals are needed in small quantity, because vitamins and minerals can cause toxicity if consumed in large amounts. And the thing with iron, vitamin C, you can get 1,000 micrograms per day. I don't think vitamin C is one of the few minerals that is actually not stored, right? But for the others, if you have too much of them, then you're going to start having problems in the body, right? Because the body has different, the vitamins and the minerals in the body would be connected to our irons, which is actually your potassium, your calcium, and even with the beating of the heart, you would be surprised. We have something in the body that is called the sodium potassium pump, right? So it is a channel that is actually used to get the heart beating. So what you find is that when one is going in, one is coming out. So one goes into the cell, right? And then you may find that you have that contraction. And then when the cells contract, then you have the other one open. And that's how you even get that nice ECG waveform that you see when persons do ECG. So that is how your vitamins and your minerals come in, and too much of them is a problem. So we have persons when we see that, oh my God, the potassium level is high, we're worried because they can get an heart attack, because the potassium is one of the main ions that is needed for the heart to contract, right? So when you're having excesses, that the heart is going to be contracting over time. And remember, the heart is a muscle. So if you have that continuously happening, the heart become tired, and then what's happening now, you just end up with a sudden heart attack. So it is very important that we do eat in moderation. Now, what we need to do for our cardiovascular health, because why we said that the cardiovascular group of diseases that we have is one of the largest group, right? And we basically want to reduce our fat intake, and there are different types of fat, right? So you want to reduce the intake of your saturated fats, your trans fats, and food that is actually high in cholesterols, because these are foods that actually gonna block your arteries later and cause problem for you. All right. So what you do, you actually replace these your meals with more unsaturated fats. All right. So the saturated fats are basically healthier than the saturated fats and the trans fats, because what the unsaturated fats does, it's basically improves your blood cholesterol level, right? So that would actually prevent you from getting the high cholesterol, so to speak. And once you actually have normal cholesterol level, or you maintain that cholesterol level, then it decreases your risk for heart attack and stroke. Because most persons, and so that is why sometimes you see a lot of persons who are slim, and you say, then him get stroke and him slim, because those persons may have a high cholesterol. So if you have a high cholesterol, then that's all is needed to clog the arteries, and then you get the stroke. So you don't necessarily, it's not always associated with the obese persons. So you might find that you have these persons who, they're not fat because they burn calories a lot. So they have a good metabolic system, meaning that they will burn the fat. But naturally now, the adipose tissue that is building up, right, and blocking these arteries because of these trans fat and the cholesterol and stuff, that can actually cause you to get a stroke or an heart attack. So you should always try to replace your diets with unsaturated fats. So one good category of this, you have your omega-3 fatty acids. Those are good sources of unsaturated fats, and that you can get from your fish, right? And we know that anything with omega-3 fatty acids always help to boost the immune system. We also have you have your monounsaturated fats as well. All right. And you can get this in olives. You can get it in olives, peanuts, sunflower, some of those plant-based. Those are healthier foods to eat. Fats. You can also get it sometimes from the animal fats, but you have to be careful that you actually consume it in the right portions. And you get animal fat sometimes from your chicken or your pork and the beef. But it's just, as I mentioned before, that it has to be eaten in the correct quantity. The portion size is important. Then you have your polyunsaturated fats. All right. And as we mentioned again, that too you can get in the sunflower, you can get that in corn, you can get that in soya bean, you can get that in, and that is why over time we had this debate going on and various studies. Some persons were saying the soya bean oil is the better oil, the olive oil is the better oil, because some of these oils are much better for your cardiovascular health than the regular vegetable oil that you would consume, because the vegetable oil sometimes it's mainly packed with saturated fats, and those are the fats that you really don't want to really concern yourself with. So from the study today, I might have to continue tomorrow. I think I'm running out of time.
Yes, we're out of time. I have some questions. Just wrap it up here and then I'll take the questions on the chat.
Okay. So as I was mentioning, what we can do as well, you can change your cooking method. So instead of frying, you can actually steam the chicken, you can roast the chicken. All of those are actually, it's less fat that you're using up. So that is actually better for you. You can actually stew as well, grill. Those are healthier choices than the fry. If you're actually going to use the air fryer, that is not bad because the air fryer doesn't really use oil. All right. But we have some persons that they like when the oil is halfway with the oil and they put the chicken in it. And that is why KFC is not very good, because when you notice, when you take that chicken out, when you look at the skin and you squeeze the skin, that's a lot of saturated fat there, because they would have fried the chicken in so much fat. That's like a deep fryer is the method that they use. And it's really not safe for our cardiovascular health. All right. So as I mentioned, you change your cooking method, and it's very important that you would have actually reduced your added sugar intake, because as I mentioned before, remember that the sugar basically has calories, right? That sugar is the form of energy, and excessive energy or calories is going to be stored as fat. All right. You control your weight gain. You have some persons that they will see that the weight is coming on and they do nothing about it. All right. And sometimes when it starts get out of control now, then it's harder at that time, because they would have actually gotten into this habit where they actually eat so poorly, and then the obesity sometimes would have actually started causing other problems. By that time when you catch them, they would have actually now start having the diabetes or the high blood pressure. All right. And as we mentioned now, the sugar intake, that is one of the main thing, and the increased consumption of fat, those two are the main reason why now we have so many persons with diabetes and high blood pressure. So if we can make the tea without, much sugar at all, then we don't have to. Because especially if you're going to have a diet that is very high in carbohydrates with your bread, or you're going to have something with rice, you really don't need a juice. You can drink a bottle of water, because what you're going to do now is increase all of this calorie. And remember that your main calorie intake per day is supposed to be 1,800 kilocalories, right? That can be more or less, it depends on the person's body mass, right? Whatever the disease condition that they're having and the age. All right. So because you wouldn't want some persons with a certain condition, you want them to probably have less calories as opposed to more. So for instance, somebody who is malnourished, right, and very thin, then we would want to probably give them a little more calories than somebody who is obese. And later on tomorrow in my presentation, I have the tables there for you. So you will actually be able to jot down how much of that you need to eat to get the right amount of, mix and so on. I will go further into that tomorrow. It's all here. So
okay, question right here, Rachel, because you are on it now. Substituting honey for sugar. Talk about that for a minute.
All right. So that is actually a good choice, because why? The honey has antioxidants. And as I mentioned, I don't remember if this person was online with the teaching that I did on, was it the poor circulation? But honey has oxidants. As we mentioned, that when you eat a meal, naturally your body actually goes through a process of oxidation. All right. So what the oxidation does is that it basically have like say for instance, you would probably have like 3 cells, 3 hydrogen cells, but you know that in everything you need a pair to bind. So you would have an excess one there floating around. All right. So when you eat too much sugary foods or too much food that is actually high with oxidation process, where the oxidation process is high, you have too much oxygen being released. What is going to happen now? You tend to have something that is released called free radicals. And the free radicals actually can actually put you, those are actually now a risk for building up carcinogens, and carcinogens are cancer producing agents. So the honey has a lot more properties than the sugar. So substituting with the honey is not a bad choice. But as I mentioned before, that in anything that you do, you still have to look at the portions, right? Your portion is still very important. But the benefits of honey, as we mentioned, is great. As we mentioned, it's an oxidant, so it actually reduces your risk for getting some of these comorbidities, and it actually reduces your risk as well for getting cancer. So
not only that, stick up in Rachel, that somebody's asking what about agave, but honey is actually one of those food that is, it has all the vitamins and minerals that we need to survive. So when the Bible says that the land, the promised land, was full of milk and honey, it's because milk is a complete food and honey is a complete food. And in ancient days, they used to use the honey not only for food, but honey was medication. So when you have a cut or a wound and they did surgery, they would use the honey as a covering to prevent the bacteria from going in and to heal the wound from within, that nothing could pass from the atmosphere into it. So honey is a complete meal. I think that you have 24, 28 vitamins, minerals, and honey have all the vitamins and minerals to sustain life, as well as milk have all the vitamins and minerals. So when God gave them the land of milk and honey, it was saying that everything you need to sustain life was already in the promised land. So honey is good. What about agave? I think agave come from
it does have
in the desert
that present antidepressants. There were actually many studies that showed
it regulates
antidepressive, right? And it actually it helps to prevent a lot of those memory disorders as well, and anticonvulsants. So persons with seizures and stuff, if they're actually on the honey, you will notice that they basically get less episodes, you know, or none at all. So honey has a lot of benefits. You can Google it and look up for the benefits of honey, as we mentioned.
What about agave? I think agave just have less calories, right? It is a sweetener, but because it's a natural sweetener, I think it has less calories. But
yeah, it does have less calories.
I was using it one time and I stopped. So I don't remember why I was using it.
That's so it actually helps with your metabolism as well. So it is actually better than the sugar, because as you mentioned that it's less calories. So you know, it would actually be an healthier way for you than to consume the regular over-counter sugar. And it also helps with your heart function.
Okay, another question here, it says, what explanation do you have when the poop look like goat poop, when the stool look like goat poop, like small and beady, like little seeds?
That is one of the indication that shows that you don't have enough fiber in the diet. So you need to increase your fiber-rich foods to correct that. And I would also just feed on the meat, and that is not good. So you have to have the fiber in your diet, which is your vegetables and stuff, right? Your beans, so you can actually have a good bowel movement. If not, that's how it's gonna look.
Yeah, and I would tell you to check on parasites. If those are eggs, like any parasite in you, then the food will just form around any parasitic egg. Or it says somebody was commenting that some medication makes the side effect is constipation. Yes, especially like antibiotics and like Centroid. And that's why they tell you, take this pill with 1 glass of water. And sometimes all they do is take a mouthful and swallow. If they say 1 glass of water, especially for antibiotics, you need to take 1 glass of water, because one of the side effects of antibiotics is constipation. So drink the glass of water and don't just take a mouthful, because it's not going to work. The same thing for like Centroid. You need to, what kind of vegetables do you need to eat after you're fasting? Just about any vegetables, because most vegetables are 90% and over water. So vegetables, lettuce, they are very, very good for you to eat after fasting. Somebody's asking, can we get the PowerPoints?
Sure.
They can. So what you can do, if you have a copy, you could put that into the Monica Jones Ministries. And if you're a part of Monica Jones Ministries, you can post it in that group, and then everybody will have access to it. I don't take sugar now for 27 years. Good for you. Because we really get sugar from the food we eat. We really don't need it. Because the average person eats, I think they said like, how much pounds of sugar per year, like 20 and 25 pounds of sugar. Our body don't need that.
We don't need it. Exactly. Remember I said that the excess sugar is going to be stored as fat.
It's going to be stored as fat.
Excessive fat is a problem. So you don't need it.
Okay, here's another one. Sometimes I feel my heart palpitation. I take magnesium and it stops. Can you explain? Why are you taking the magnesium? And who tell you to take magnesium?
All right, so that is a whole different topic in itself. Remember, I just mentioned about the sodium potassium pump. These ions actually channeling all the for the cardiovascular pathway. It's actually as all of those ions that is needed for the beating of the heart, the contractility of the heart. It's just that the sodium, the potassium, and the calcium, those are the main drivers. But you do have working below the cells, behind the scenes. You have the magnesium as well, right? You have, what's the other one? Phosphorus. All of those work in collaboration, right? But that is why we said that you really need these foods that you get from your fruits and your vegetables, right? But you still need them in moderation, because too much of them, that can cause a problem. So what happens is that if you find that you actually take the magnesium and you're feeling better, it means that your body was lacking in magnesium. And a lot of persons have muscle contracts.
Magnesium is one of those that you take in microgram, right? Not you're not in milligram, you would take in microgram.
The vitamins are all in micrograms. The vitamins are in micrograms. And if you notice, that's why I mentioned here that you take vitamins in small portions. They're in micrograms. If you take those in milligrams, you're going to be in problems. Because as I tell you what the excess potassium can do, right? Because overwork of the heart, and that can cause the heart to stop at any minute. The magnesium, as we said, if you notice, some persons that get muscle contract too, you know that they tend to have that. A lot of them, if you check their diet, you're actually lacking in calcium. All right. So if you're somebody that is not, you can't take dairy-based food, there are a lot of other products that you can get calcium from. So if you're not somebody that probably eat dairy product, you do have non-dairy milk that is actually very, very rich in calcium as well. But your calcium is very important, especially for women. All right, that is what helps to drive the menstrual cycle. And if you notice, that is why women who tend to reach menopause, they tend to sometimes get pathological fractures, because they would not have had arthritis. Right, they don't have enough calcium producing anymore, so they get the bone just break, you know, suddenly, and they don't even know. So a lot of those persons, if you're not gonna have calcium rich food, then you're gonna have to get the calcium supplement over the counter.
Right, and it's recommended that once you turn 20, you start to take the supplements just to balance what you're taking. And someone is recommending date syrup or sugar is good too. And I think palm, you can even get sugar from the palm or even the beet, just about any kind of natural sugar.
Remember that we said that the plant-based has cellulose. So you do get sugar from it. It's just that it is in the form of cellulose. And those sugars too, they are not so highly compact as the regular sugar. So those sugars tend to basically be, they are very absorbable. They absorb very fast within the digestive system. So you can actually use those.
Somebody's asking, is stevia any good? Stevia.
Stevia?
Stevia, you know, the substitute, I don't like the substitute at all, whether it's a sweet and low or sucre, I don't like the substitute at all. I don't trust them.
I'm not sure about that one.
Stevia
I
is
have
a
to read
brand. You
up.
have stevia, you have sweet and low.
Oh,
You
so it's the
know,
brand.
sugar substitute. Yes, stevia is a brand.
It's the
Sweet
brand.
and low, I think, was the first one that came out, and then stevia came out afterwards. I don't trust none of those.
Well, for those would actually be better than the natural sugar, but then you have to be careful, because what you can do is actually pay attention to the content at the back, because they usually, some of them have contents, not all of them, that will tell you like the amount of calories that is in each. But I know that is actually, the portion size is usually, in terms of calories, is usually less than the regular sugar.
Okay, someone is saying sometimes ago I read in the Gleaner article that both honey and sugar has the same component. Is that so? That's definitely not so.
No, they don't have the same component.
Honey is a complete food. All the vitamins you need, all the minerals. It's a natural sedative. It is way, way superior to sugar. You cannot classify them. They will have a lot in common, but the honey is way superior to sugar.
That article would have actually been pointing to persons who are diabetic, because you know, with diabetics, because their body is not functioning well, even if they have it with honey, it's gonna send the sugar up. Yeah. So I think that's not for normal persons, because honey is actually at class 1 antioxidants, and antioxidants are very good. So that's not true. They should have been actually specified that is basically for the persons.
Right. But it's not true.
But it's
How
not
can I become a part of the Monica Jones group? Then you can, if you get a flyer from me on WhatsApp, you can contact me on WhatsApp and I'll add you to the group, because we post information there and everybody get the information at the same time. It's much easier, although sometimes I'm confused about who is on the group and who is not. That's my number. Contact me on WhatsApp, give me your name and we'll add your name to it. So when she posts the PowerPoints, then you can have access to the PowerPoint. What if you mix the honey and sugar? That is too sugar. You will never mix.
So if you notice that I mentioned about the portion size, so again, you're killing yourself, because the honey has calories.
That is sugar and sugar. You don't mix honey and sugar.
You don't need it.
One is a substitute for another. All right, so this is the end of all the questions. Thank you so much. Join us back tomorrow. And if you know anybody that need this information, please invite them to come on tomorrow. And we'll be going to be talking about this some more. Share the link with someone. I'm not sending out the link tomorrow. Share the link with someone and come on and let's we're going to talk about portion size and alternatives to having a big meal and just to stay safe during the holidays. So God bless you. Rachel, get some sleep. We'll see everybody tomorrow. I'm closing up now. Thank you so much.
Please to join on tomorrow. Invite someone so we can see the amount of calories and amount of calories is needed for different age groups, so you can actually pass it on to your parents and your grandparents.
Yeah, nobody sell honey with sugar in it. When honey, sometimes you have honey for over a period of time and it settles, it will have its own sugar at the bottom, but it's not added sugar. It's the honey own natural sugar. Okay, so invite somebody on tomorrow so we can do the portion size and everyone will have access to the information. Everybody, you're responsible to invite 5 more people and probably 1 will come. But see you all tomorrow, same place, same time. Anybody wants to get access to the PowerPoints, please contact me on WhatsApp and give me your name and information so I can add you to the group. So when it's posted in the group, you'll have access to it. All right, God bless you. See you tomorrow.